The skin is almost certainly infected if the condition is chronic. And the key thing in which will give you the best chance of healing, the healing may lead to remission, i.e. it may give the body a chance to heal from within by controlling the infection.
Welcome to the Healthy Skin Show with Jennifer Fugo, where we're flipping everything you've been told about your chronic skin issues upside down and connecting you with alternative solutions your dermatologist never told you about.
Hey, and welcome back to episode number 4. Today, I'm going to be sharing a bit about what the best way is to get from being completely clueless about what type of skin issue you have to finally having some sort of plan in place. And then I'm going to be sitting down with a really amazing guest. I consider him to be one of the most forward-thinking dermatologists out there, worldwide, actually. His name is Dr. Richard Aron. You may have heard of him. He has created what is known as the Aron Protocol, and we'll be diving deep on his approach to addressing chronic eczema. But first, I'd like to answer a listener's question. Joyce contacted us to ask something that a lot of people who are trying to find a more root cause approach oftentimes don't think about in the rush to just stop the symptoms. And I also would argue that in the conventional space, there is this idea that we'll just slather on some steroid creams, it'll fix everything. And so let's hear from Joyce, because this is a good one.
There is so much research on how to treat chronic skin problems, such as eczema, etc. And there's so many different types of treatment plans. Isn't it necessary to test first in order to determine the individual's exact cause and then to diagnose and come up with the right treatment plan? That's my burning question.
Joyce, this is an incredible question. I want to thank you for bringing it up. And I wanted to address it now at this point early in the Healthy Skin Show because this is something that I routinely see, so to speak, in my clinical practice, wherein people don't always know what exactly is going on with their skin. And there have been times where they've gotten very conflicting diagnoses. One doctor will say they think it's this, another doctor will say they don't think it looks like that, but nobody's bothered to actually run any tests or biopsies to really get a more definitive answer. And so it's my feeling that if a client describes to me their symptoms, if they show me pictures, and granted, again, I'm not a medical doctor, so I'm not allowed to diagnose, but if the symptoms and everything don't make sense with the diagnosis they've been told and other doctors have questioned it, I will recommend that they go back to either the dermatologist that they've seen or go to a different one and request a biopsy. At least that way they can get more answers for what's going on. And so in the functional medicine or functional nutrition realm, we always say test, don't guess. When you've had a bunch of things run, you finally have some answers. I find that within the skin realm, especially when I was going through this myself, that there's very few labs, if any at all, that anyone will run about your skin, which is sad because your skin is the lowest priority as far as the organ totem pole is concerned. So there are typically underlying reasons why the skin is experiencing whatever it is that's going on. There is an importance in figuring out what the exact diagnosis is because some skin issues may require slightly different approaches. There certainly may be some similarities, but the way you would address, say, eczema as compared to more of yeasty dermatitis might vary quite differently depending on what labs come back. And so that's why it's important to remember as well that you want to take a deeper look. And that's what I help my clients do, because to me, just having say regular labs run every year, like maybe a CBC panel and a comprehensive metabolic profile, is not enough in this particular case. First thing I want to get clear on is all of the symptoms that they have, not just the skin symptoms. I know we're talking about testing, but the symptoms matter because they help tell you where to look and what to test. And so from there, if you can, I would recommend utilizing both conventional as well as functional labs that make sense. I don't necessarily think that you need to have every functional lab in the book run. That is very expensive unless you have all the money in the world and don't care. But my clients are budget conscious, so we try to pick what will find the best answers for them so that we have a plan moving forward. And actually, in our show notes, I'll link to an article that we have on some of these conventional skin tests that I typically ask to have clients run, as well as a really great free handout that I have that will include both conventional and functional labs that I use within my clinical practice. Now, once you have a much clearer picture of what's going on, so not just a diagnosis of like eczema, psoriasis, rosacea, lichen sclerosis, whatever it may be, you then have to say, okay, well, what is underlying this? What else is going on that could be causing a disruption in other systems that then trickles down to the skin? And that's why this is so important. So your protocol, it may be in phases, number one. And number two, it can include things like medications, supplements, food changes, environmental shifts, as well as lifestyle changes, things like breathing exercises or reducing stress or going for massages, doing things to help improve your resilience. When clients are most open to these possibilities, and that has to be based on your personal preference for how you'd like to also address your health, because everyone's different. Some people don't want to use conventional medications, though sometimes they are helpful and appropriate. But you have to decide what you're okay with. Once you get that plan, you're willing to follow through with all of the pieces, not just the pieces that are most convenient to you, because there is benefits found in the things that maybe don't cost you money, like breathing for 2 minutes or going outside for a walk, doing things that are not necessarily like taking a pill, but also help the body calm down to reduce its reactivity and reduce the amount of stress that you are experiencing in that moment. And you're right, there has been a lot of research done over the years about how to address all of these different skin issues. But what I found is that there's a lot of very new research that's coming out that I find to be more valuable and more interesting, because what we're seeing, when you go to the dermatologist, many of us have the same experience. The doctor looks at your skin, they tell you what they think you have, they hand you some sort of steroid, and they kind of send you on your way. Not very interested in looking any deeper. We're not seeing this newer, more innovative research trickling down into clinical practice or into that exam room unless you happen to get an appointment with a dermatologist that is interested in all of this new stuff that's coming out. Things that include CBD oil and probiotics and all sorts of connections that extend beyond the skin. So it's not just looking at the skin, but looking at your gut, looking at your liver detoxification system, looking at your hormones. They're looking outside of the skin and looking at your body as one whole unit as opposed to just the skin. And that was one of the reasons why I started the Healthy Skin Show, because I feel like as a patient, I want to be more empowered when I walk into that room. I wish that I knew the things that I know now. And if as a community, we can ask, not beg, ask, and maybe even demand that conventional dermatology starts to pay attention to this new research, to start re-engaging and looking deeper, then maybe we can get that whole system to change so that all of us can see better results and rebuild healthier skin. All right, I think now is a great time to hop on over to my interview with Dr. Richard Aron. As I said, it was a great honor to have him on the Healthy Skin Show. I imagine it will not be the last, but without further ado. Hello, everyone, and welcome back. Today, I have a very special guest with me, someone who I am deeply honored to have the opportunity to interview because, number one, he does not live in the US. We are talking to Dr. Richard Aron. He is in South Africa. Thank God for Skype because we're able to have this conversation. And if you're not familiar with him, you should be, because what he has done for his patients with eczema is truly remarkable. And his even willingness to give his protocol and share it with other dermatologists who are open to the idea is also astounding. And so I wanted to have him here to share with you what he's been able to do. He's definitely doing something that is still using traditional medicines, and I could be wrong about that, but Dr. Aron will tell us. He'll dive into that. But he's doing something completely different in a different way. And I believe that while, yes, I love having natural alternatives, the reality is if we have access to medications that do work or protocols that do work and help us get to an endpoint, which is having clear skin and getting back to a more normal life, then it is worthwhile to investigate, and you shouldn't feel bad about any choice that you make because your decision of how you help your health and your skin is personal. So, Dr. Richard Aron is a world-renowned dermatologist with a special interest in atopic eczema. He is based, as I said, in Cape Town, South Africa, and he is the creator of the Aron Regimen, which is completely different. It's a totally different way of approaching the treatment of eczema. So, welcome to the podcast, Dr. Aron.
Wow, thank you very much for that incredibly complimentary introduction. Highly appreciated. And I'm very pleased to be with you.
Yes. So tell us a little bit about how you figured out or came up with the Aron Regimen and what it is. Because I think a lot of people aren't, they're not familiar with it, and it would be good for them to know how it differs, what it is and how it differs from conventional treatments of just use a steroid cream.
Well, yes. It's not an altogether simple answer, but the ultimate answer is one of simplicity, because firstly, my regimen and my protocols of treatment have been evolved and refined over very, very many years indeed. And what I've discovered, once again, many years ago, is that probably the most important trigger and maintenance factor in so-called ASD or atopic skin disease or atopic dermatitis or atopic eczema, call it what you will, is infection of the skin with a bacterium called Staphylococcus aureus. And central to a successful continuing outcome of treatment is you have to address the Staph aureus, meaning you've got to get rid of the bacteria to get a lasting control of the eczema. Now, how that is achieved is another matter indeed, because firstly, in the medical literature, it is clearly stated that between 70% and 90% of patients with active AE are infected with pathogenic, meaning virulent Staphylococcus. Now, how do you treat that? That is another matter altogether, because in the first instance, you have to make the diagnosis of infection. And that is quite often overlooked even by the most experienced physicians. Having decided that there is infection, you then have to treat it appropriately. And oral antibiotics, which are often prescribed, are usually not altogether successful, especially in low-grade infections, as opposed to fulminating, horrible, weepy, sore-type infections. So what I have done, and I'll try not to go on too long about this, but I have done something which confounds common sense in the sense that I've taken a steroid, which we all use and is widely available in America. I've taken an antibiotic, and the antibiotic which is available in the United States, is mupirocin 2%, either in cream or ointment form. And I've taken those two active products and put them in a moisturizer. Now, this is where the trick comes in, because I've weakened the steroid, weakened the antibiotic, and increased the amount of moisturizer, and they are applied simultaneously in a compound to wherever the eczema may be active. And ironically or contradistinctively, this combination of dilute product works much, much better than using undiluted products individually at separate times. And because they are diluted, it means that you can continue with the treatment even when the eczema is much improved or clear, because you do need maintenance therapy. So you cannot stop the therapy once the improvement has been achieved, because the AE is a chronic relapsing condition. And if you do so, it will come back again. And then everybody gets very upset and very disappointed. So there are many other aspects to the Aron regimen, but those are the key aspects. Treat the infection, use dilute steroids, moisturize simultaneously, and use a compound that can be continued with for long periods of time.
And this protocol allows you to create a situation where the patient actually starts to make improvements, because that's the number one piece to this. I think people forget that, even when I was dealing with my hand eczema, I still used steroids in order to help reduce the inflammation. And
Correct.
So I don't like to demonize medication. My father's a doctor. And so I grew up having a respect for medicine as a whole. And I think everything has its place and serves its purpose. So something like this, by diluting the medications, does that also reduce the rebounding effect that can happen sometimes when people use these really full strength, heavy duty steroid creams?
Yes, definitely. It does reduce the potential for rebound. There's no question. But in regard to speed of response, now bearing in mind that the patients that I see are invariably in a very, very desperate state, because very few parents or adults with the eczema will approach a doctor online because of fear of scams and all sorts of unethical or inappropriate behavior. So these patients are pretty ill. Now, when you take an infant, maybe say up to the age of about 2 years with infected skin, the progress can be very, very dramatic indeed. They can sometimes get clear on this CASM, combined antibiotic steroid moisturizer cream, extremely quickly, often within 48 hours.
Wow.
Oh, yes. And even in adult patients, the burn from the staphylococcal infection can be eliminated as quickly in 48 hours. Now, let me hasten to say that that's not a cure of the eczema in 2 days, but it's certainly, to answer your question, it is a very dramatic relief of symptoms. And then the treatment has to be managed subsequently, because as the patient improves or stabilizes, the frequency of application of this product is tapered off. So the dose of the steroid and antibiotic is steadily reduced, even though the treatment is continuing. So the fear of steroids and the fear and phobia, dare I say, of antibiotic products should be shelved, not only by parents and patients, but also by medical professionals in whom the pendulum of avoidance of these products has swung from excessive use many years ago to inadequate, dare I say, use today. So many of the benefits of these products are being denied to patients because of the bad reputation of topical steroids and topical antibiotics. So like everything else in life, the middle way, a moderate way, is in my opinion, the best and most effective way to go.
And I wanted to underline something that you had said. So this treatment or protocol regimen, it is okay with infants and with young children. So all ages, you've treated all ages with this.
Absolutely, yes, indeed. I sometimes get infants as young as 3 or 4 months of age who've had the eczema, so-called, from almost from birth or from 2 or 3 weeks of age. But this is a very interesting point, because these little ones who are covered in these red dotty spotty things, I'm beginning to believe from obviously my own experience that these are primary staphylococcal bacterial infections, and they are not eczema as such. But if they are not adequately treated, the chronic inflammation turns that rash into an eczema. But of course, this is an anecdotal, observational opinion, and it's certainly not widely accepted within the profession. But having said that, it doesn't change the treatment principle. You have to have your topical antibiotic in that moisturizing steroid compound. And here is the point. In an infant, I may take 15 grams of steroid cream and dilute it in as much as 250 grams of moisturizer. So the concentration is approximately, my math is not that good, but it's probably about a 16 times dilution of the steroid.
Wow, that's really low.
So we are using an extremely low intensity, which brings me back to my earlier point. When you use that with the antibiotic in the moisturizer, there is a phenomenon called synergy. And what that means is that the antibiotic potentiates the activity of the steroid, and the steroid potentiates the activity of the antibiotic. Because the antibiotic kills the germs, the steroid reduces the inflammation, and therefore you get a beneficial cycle going round and round, instead of the vicious cycle of suppressing with steroid, not killing the bacteria because there's no antibiotic. So as soon as you stop the steroid, which you have to do, bingo, rebound. And that is part of my rationale behind the use. But I should say this, that the treatment for a 6-month-old or 1-year-old infant will be distinctly different to an adult who's had eczema for 20 years, because you would use the same products, but more potent in adults for obvious reasons.
Naturally. And so for someone who does not have the means to, and I imagine you're super busy, by the way, I can imagine, but if someone can't afford to come to South Africa to see you, from my understanding is there are some doctors in the US that you have either collaborated with or are trained by you in this regimen. And you're also, from my recollection of researching you, you're very willing to even share your protocol and how you do things with practitioners and doctors on your website. Is that correct?
Yes. Well, let me say immediately that the two physicians from whom I've received the most support and recognition are respectively Dr. John Van Wagener, who is a pediatric allergist out of Dallas, Texas. He and I work in close association on the management of patients. And John manages, in essence, all patients who want to follow the Aron Regimen within the continental United States.
Okay.
Which is quite an important factor. The other colleague to whom I owe a vote of gratitude is Professor Peter Leo, Associate Professor at the Feinberg School of Medicine, Department of Dermatology, out of Northwestern University in Chicago. Dr. Leo is an open-minded physician who has invited me to present papers in Chicago on 2 separate occasions, first in 2015 to his so-called Eczema Integrative Group, and then subsequently, as I mentioned earlier in our talk, at the recent Eczema Expo. And he has adopted my regimen protocols for many of his patients, most particularly the ones who, shall we say, fail to respond to simple conventional means, and where he feels something different may be required. There are other doctors who follow my regimen, but I have no feedback from them. So whether they are doing it and how successfully they are doing it, I'm not at all sure. So my recommendation, if I may be so bold,
Please,
is that people who are particularly struggling should contact Dr. John van Wagenaert. His website is eczemaspecialist.com, simply as that. Or Dr. Peter Leo, who has a conventional practice in Chicago. I don't think that Professor Leo consults online. So it means that patients who have access readily to Chicago could consult with him.
And we'll put links to both of the doctors in the show notes for anyone who's listening to this so that they'll be able to easily find both physicians. And I really want to appreciate you for just the work that you've done. You know, I agree with you. There's a lot of people that are nervous and afraid to try different things because there are scams online, especially when health issues are concerned. I know that I was always like, gosh, I was so desperate. My hands wouldn't clear up from just doing topical steroids that I was desperate to try anything. But it was always this, oh, everyone wants you to do a detox or a cleanse or all these other things, which I'm not necessarily comfortable with. So the one thing that I can say is that I had spent a long time. I found you because of the National Eczema Association, and I did a lot of research on you, and then joined your Facebook group, which I'll also put a link to in our show notes, if that's all right, to share that group with people. It was really inspiring to see the photos of where your patients had started and where they are now. Truthfully, the proof is in a picture.
Absolutely.
And it's just so great to know that there are novel alternatives out there, and I want to help give those options and spread that information to other people that are empowered to look deeper and to look someplace else because they feel like their dermatologist has run out of options.
That's absolutely fabulous. And I would like to say this. I like to be, and try not to be, dogmatic in response to some of the holistic approaches that are used in eczema. And where my protocols come into play, I have to say is this, that the vast majority of patients who ultimately consult with me have tried every other method under the sun. Multiple orthodox physicians, dermatologists, pediatricians, allergists, pediatric allergists, you name them. They've tried everybody. They've tried homeopathy. They've tried naturopathy, acupuncture, kinesiology, and even faith healing. So all of these things come down to my original point, which I would like to remind your listeners about. The skin is almost certainly infected. The condition is chronic. And the key thing in which will give you the best chance of not a cure, because I do not claim to cure, but it'll give you the best chance of healing. The healing may lead to remission, i.e., it may give the body a chance to heal from within by controlling the infection. So that is the route. We say route in South Africa. Sorry about that.
That's okay.
So your listeners must pay attention to that potential. And if anybody wants to get in contact with me, they can just go on Google or Facebook, Dr. Richard Aron, and something will come up on me.
Absolutely. And we'll link all of that in the show notes. So it's super easy for everyone who's listening to find you and learn more about what you're doing. And like I said, this may be the answer for some people. And I also don't see why it might not be a way for someone to do something like, again, as I was addressing my issues from a more alternative standpoint, I still use steroid creams. I mean,
yes.
People want to believe that steroid creams, I got to throw them away. It's good. You know what? You have to reduce the inflammation. You have to reduce the symptoms. So even though someone may choose to go this route, they may also want to do some other work internally to see if there's other issues going on that absolutely are perpetuating the inflammation as well. So I see a lot of synergy here. And I'm so appreciative that you took the time out of your busy schedule to join us. So thank you so much. I hope that you've enjoyed that interview with Dr. Aron. For me, it was a tremendous honor. After the interview, my husband asked why it was that all of these big names in dermatology, both in the integrative world as well as the conventional world, were willing to accept the invitation to be on the Healthy Skin Show. And what I said is, Well, nobody else is really asking them to talk on these topics, and I am. I want to have these conversations, and they want to be a part of it. It's my hope that by sharing Dr. Richard Aron's work, that if this seems like the right pathway to you, this may be something that will help you. And that was what was most important to me, to share the options. All of the links that we've discussed, including his Facebook group, which you're able to join, even though you may not be on his protocol, will be in the show notes. That way you can connect with him. And we will also have other colleagues of his on the show as well. So stay tuned. In the meantime, I wish you well, and I look forward to seeing you in the next episode as we continue to work on helping you rebuild healthy skin.